Okay, welcome everybody to our talk about supporting your child with ADHD. I'm Sarah Rosensweet, Peaceful Parenting Coach, and today I have with us Dr. Mary Wilde. Mary, or should I say Dr. Mary, thank you so much for joining us. And if you don't mind just telling us a little bit about who you are and what you do.
Sure. Thank you so much, Sarah, for having me. So I'm Dr. Mary Wilde. I'm an integrative pediatrician, and that means that I take a whole child approach to pediatrics. I think every pediatrician should be an integrative pediatrician, but my focus is particularly on behavioral issues, and I especially love the topics of ADHD and anxiety, and so I'm so happy to be able to talk to you about ADHD today. So if it's okay, I will go ahead with my slides and then we'll have a little Q&A at the end. Does that sound good?
I would love that. That sounds great.
Okay. So I am a mom of 8 kids. They're all boys. So we live in southern Utah.
I did not know you have 8 children.
Yes.
That's amazing.
So this is a picture that's kind of old, but I love it because we had just moved to this area and we went to take these pictures and it was like it was made for us. There was like a little indent for everybody. So as you can imagine, my name is Imagine Pediatrics, but as you can imagine, my household is a bustling household. And so I really understand the challenges of a lot of energy, a lot of things going on, and how challenging that can be as a parent. So this is my website, and so you can see that there are a lot of different behavioral issues that I address, but like I said, ADHD and anxiety are among my favorites. So let me start by telling you a little bit about my story, why I got passionate about this topic. So when I was in my pediatric residency, I remember a specific day when they passed out these workbooks to help us prepare for pediatric boards. And on the section about ADHD, there was just this huge table of medications and dosages and side effects and indications. And then there was only one other suggestion of what could be done for ADHD, and that was sticker charts. And I just knew that was not the whole truth. I knew that there was more that could be done. And so that was my beginning of kind of looking for a broader approach. Then fast forward several years, and one of my sons started exhibiting the classic symptoms of ADHD. And so it became a really personal question, not just a theoretical question of, how should ADHD be addressed and approached? And I remember those early years and how hard it was. I'd bring my family to a concert, for example, and all my energy would go to helping this child, not be disruptive. And I also, though, I just loved his energy. Something just showed up on my screen. Let me go back. I loved his energy and his creativity, and I didn't want any of that to go away. And so I wanted to find a way to approach all this energy and this creativity and this movement. I wanted to approach it in a really positive way rather than calling it pathological. So in our family, we chose not to medicate my son, and we just worked on skills and helping him work on different weaker areas by using his strengths. And for our family, that worked out well. But there are many families that I see in my clinic who, while we look at the whole person approach, we decide in the end that, yes, it's time to do medication. And I think that helps a lot of families as well. So, but in my clinic and as somebody who works in the parenting space, I encounter a lot of families who are in this struggle, in this question of how do I celebrate who my child is, but yet help them be functional and help me keep my sanity and help us preserve our relationship. And one beautiful, beautiful post that I found recently, and I share this with permission of the author. This is a mother, her name is Becky Kingsman, and she talked about how about 18 years ago she had her child, and as he grew, she just could hardly contain his energy. And she said that she discovered that she was the mother of electricity. And I love that image. And she talked about how it was like super inconvenient and it was hard to contain this. And it practically drove her crazy. But over the years, she came to wish that she had been able to kind of stand back and observe this, what she called an electrical storm, and see the beauty of it rather than, feeling so weighed down by it. And so this is really what I help families do. I help families find a really holistic and complete approach to ADHD while celebrating the strengths of their children. And I think that that's so important, especially even in the name of ADHD, we have like a double negative. It's a deficit disorder. And so that's kind of an uncomfortable label to give somebody. You have a deficit disorder. But when we can approach it and say, these are your strengths, these are some of the areas we need to work on, and let's do it. It's a whole different thing. So just a little background about ADHD. I'm sure you're familiar, but it's characterized by a difficulty with focus, impulse control, and or organization. And really the pervading thought at this time is that it's a brain-based neurodevelopmental disorder. But because it's usually diagnosed clinically, the diagnosis really doesn't say anything about the cause, and it takes all comers. And I really consider it to be a multifactorial condition. We know that ADHD risk is higher in certain families where there's a predisposition, so it does run in families. When there have been toxic exposures in utero or at a young age, there's a higher risk. There are other environmental issues and factors that contribute to ADHD being more likely, and these include certain permissive parenting styles, a less organized structure of scheduling and environment, and also temperament. So there's so many things that can go into this picture. Now, for a diagnosis, usually it's a clinical diagnosis. There are 9 different factors or questions that if these characteristics are present, 6 out of 9, then you buy yourself a diagnosis. And that being said, there can't be any other explanation for the behavior. The behavior has to be present in multiple environments, not just one, and it has to have been going on for a period of time. So about 10% of kids between the ages of 5 and 17 have at some point been diagnosed with ADHD, and males represent a bigger percentage. And I think one thing that I ask myself when it's 10%, according to CDC data, is this just neurodiversity? Is this a variant? Certainly in certain cases, when we know there's been some type of injury or we know that there is a pathologic reason, then yes, that is different. But in some cases, perhaps it's just a difference. And I think it's important to acknowledge that. So the first line treatment, in the traditional pediatric sense, is stimulant medication. And about 62%, according to some data that I ran across, about 62% who have the diagnosis do take medication. And it can be very effective, but it's certainly not the only option and not the only thing to do. There's some studies that show that people who take medication, nothing is really different for them years later in terms of their skill level if they haven't done any skill training, strength training about organization and focus and things like this. So the medicine doesn't necessarily do anything except help focus in the moment, So it's not like an antibiotic for strep throat that it actually like changes something within us and then it's fixed. It just is something that allows better functioning in the moment. And there can be some side effects from medication. But if you really work with a physician and find a proper dose, then there shouldn't be side effects on a proper dose and on a proper match of a medication. So we look at things like appetite, sleep, also just personality changes. Sometimes when people are on medication, they will have a little bit more aggression, or they will sometimes kind of shut down and be a little less animated. And if those things are present, then it's either not the right dose or not the right medication, because we certainly don't want to trade one problem for another. So let's get into why we would even want a diagnosis for ADHD. I think, in some cases, it may not even be necessary. So, for example, with our son, we didn't necessarily talk to him about, we think you have something that is called ADHD. We just noted it internally and just kind of made accommodations ourselves and celebrated him. But there was a time, it was interesting, he was reading a Percy Jackson book, and he said, "Mom, this character is like me." And the character was this ADHD character. And we were like, yeah. And then we sat down at that time and had a conversation. And I asked him, do you wish I would have talked to you about it? Do you wish we would have put you on medication? And he said, no, I actually don't. I'm really happy with how you did things. And so I think we have to just be sensitive. We have to be sensitive to what we think is best in our own family. But a diagnosis can serve some purposes. It serves the purpose to give some self-understanding. So if people are struggling and saying, like, what's wrong with me? Why is everyone else seeming to be able to get through this test fast and I seem to not be able to? Why am I getting in trouble all the time? So it might bring some self-understanding that's positive. But what we want to not have happen is for a diagnosis to become a negative identifier and a negative label. So another purpose of diagnosis is to qualify you for accommodations, because you can't just go to your teacher and say, my child needs a little extra time on tests and a little extra time for homework and maybe some different desk arrangements. If you don't have a diagnosis, then usually they can't really make the accommodations. So it can serve that purpose. It can also give a sense of community and a sense of a path. So what some different options are. And it's a set treatment path. And so that can be helpful. I think, though, it's really important that you insist on a really thorough history and physical. A lot of times when kids go to the doctor to get an ADHD diagnosis, it's just basically like asking the questions. Okay, yep, your child qualifies. Here's the prescription. See you in 4 months, or see you in a month, and then spacing it out to 4 months, 6 months. But it's so important to rule out some other things. For example, a child with learning disabilities can present as someone who has ADHD because, of course, they're not going to engage in the material. And of course, it's going to be less interesting to them if they're really having a hard time absorbing it. Kids with vision or hearing problems, also, same thing. They don't have ADHD, they just need glasses, or maybe they need a hearing aid. And also looking at environmental issues in the family. I don't think it's a problematic thing. So it's not something to, implicate families or blame families, but just to recognize, if you're more of a go with the flow kind of family and you don't have really rigid structure, then you might have more of a child that is a little free-flowing and creative and doesn't do as well with rigid structure. And that's not necessarily a bad thing. But just recognizing that can help just kind of sort it out. I also see that excessive screen time can contribute to an ADHD-like picture. And let me tell you why. So I've done work with a mindfulness expert named Ron Siegel, and I love his explanation of mindfulness and how it's really a skill of giving your attention. It's a skill of attunement. But right now in our culture, we're presented with a lot of high stimulation type entertainment, like flashing lights, fast moving things, and we become accustomed to that, and we lose the skill of attuning to more quiet, detailed things that aren't, grabbing for our attention. So all that being said, sometimes these things are present and ADHD is there too. So even if you, address learning issues, get glasses or a hearing aid, accept your environment or change it, decrease screen time, sometimes those behaviors will still be there, either because they've become habits or because there's just an underlying situation that needs to be addressed. So it's just more complex than I think can be addressed in a 15-minute office visit. So it's really important to find those points of intervention. So the interventional approach that I use is a strength and skill-based approach. So I start out by saying, what are you good at? What are you amazing at? What are you known for? Because I think we always have to start with our strengths. So often we can go to the doctor and it becomes the reverse of that, where we go to the doctor and they basically are saying, tell us how this child is a problem. Convince us that this child is a problem. And they sit there and listen to us saying, well, they do this, they're getting in trouble all the time, they're always doing this, and I think that can be damaging, not permanently damaging, but every little time that we are focusing on the negative about our child and kind of sharing that as the main focus, then it can become problematic. So I specifically am trained in an approach by a friend of mine, Dr. Lara Honos-Webb. And if your child has ADHD and you haven't read her book, The Gift of ADHD, I suggest you do. And also, she has a new book that just came out called The 6 Super Skills. And so she has this training that professionals can go through to learn her method and model for helping kids in a clinical setting with ADHD. And so that's what I use as my framework for having a skill-based approach. I also talk with parents a lot about finding a matched environment. So the traditional school system is not usually a really great match for kids who have ADHD type symptoms. And then constantly putting kids in situations that are very hard for them can chip away at their self-efficacy and make them feel like they're failing, as opposed to if we put them in situations that they can really thrive in, and then also challenge them with some other environments, because our kids do need to learn how to exist in those challenging environments. That's just part of life. But if we can really find some matched environments for them, then they can feel a lot better about themselves. And I'll tell you a little story connected with that. So in the early mid-1900s, there was this little girl and her name was Jillian. And she was taken by her mother to a doctor, a behavioral specialist, because she was always moving around and was having trouble in her school. And the doctor just watched her, and there was some music in the background, and he just watched how she moved the music, and he said to the mother, your daughter doesn't have a behavior problem, she's a dancer. And so the mother went and enrolled her daughter in a dance school, and the little girl became a famous ballerina named Gillian Lynn. And in her memoir, she talks about how this changed her life so much. And she said, suddenly I was with people like me who needed to move, to think. And so this was an example of someone who found a matched environment, and a parent who facilitated a child to find a matched environment, and how that really allowed her child to thrive. Now, like I said, not every environment is going to be a matched environment. Like, for example, me taking my son to concerts. Music is really important in our family, and I wanted him to have that exposure, but it was really hard to take him to concerts. And certain ones maybe I opted out of because it was too formal of a setting for him, but I still tried to do it. And I remember the day when I was at a concert with him and he was just quiet. And it's just like he had matured enough, and he naturally gained that ability with practice. And it was just a internal moment of celebration. Other things that I talk to families about are optimizing nutrition, activity, and sleep. So in terms of nutrition, some kids are more sensitive than others to their diet. I think all kids should be on more of a whole foods type diet that doesn't have a lot of processed things and junk food. That's ideal. And also taking like a multivitamin, omega-3s. I think every child would benefit from these things, but especially kids with ADHD. And there are a couple different diets that people have found success with. Not that every child will need to be on a special diet, but a couple diets, if you're interested in researching this, would be like the Feingold diet or the Reed diet, which is a low glutamate diet. So those are a couple things to think about. Activity is so important for kids with ADHD. And I think this is true for the kids who have the hyperactive component and for the inattentive component, because we know that exercise boosts focus. And a really good book on this is called Spark. So that's one that you can go and search out on your own. But exercise is a really important component to helping kids get the movement they need, and time outside. It's just, that is a place where they can really express, and they don't have to be, hushed and contained. And so it's such a beautiful gift to be able to take them outside. I know that with coronavirus, we're limited a little bit in what we can do and where we can go, but usually there are still places we can go and take our kids. I feel really fortunate to live in southern Utah. It's right by Zion National Park, and so there are a lot of hiking trails, and I can drive 10 or 20 minutes from my house and find a place, and I feel so lucky for that. I know not everyone's in that situation, but usually there are some places we can find to just get outside and be active. And finally, sleep. Sleep is so important. I've heard it said that sleep is the secret sauce. When we're sleep deprived, and we all know this as moms and parents, when we're sleep deprived, our focus suffers. When we're sleep deprived, our ability to remember, our ability to learn suffers. Our mood regulation suffers. And so really optimizing sleep for kids who have a tendency toward ADHD type behavior is so important. And then finally, after we've done all this and gotten a thorough history and talked about a lot of different factors, then that's when we start talking about supplements or medication. So I will mention that I do have a ADHD lifestyle and supplement guide that maybe Sarah can post in the description of this talk. And so I can share that with you, Sarah, after, but it's at drmarywilde.com/ADHD-guide, lowercase guide. So Sarah, I can share that with you, but that's just gives some ideas of where to start in terms of just more the lifestyle and modification and learning a little more about the supplements, because I think that a lot of families struggle knowing even what to consider. And usually it's the people who are selling the supplements who are telling you, yeah, this is a great product. It will solve all your problems. And then the doctors and pediatricians, they're like, I don't know about that. I can't recommend anything. And so you're kind of like stuck researching on your own. So I got together with a compounding pharmacist, and we put together this resource where it talks about different common ingredients in supplements for ADHD and why they work. And so that is basically my presentation, the formal part of it, and I'd be very happy to hear your comments, hear what ideas that brought up in you, and also hear any questions that you have. So I think I will go out of my screen sharing.
That was amazing. And tell me if can you hear the drilling just outside I've been muted. I hope
I can hear it now, but
right outside right now. Okay, so if anybody has questions, pop them in the comments. I see we've got one from Summer, but I just wanted to say that was great. I had a personal investment in inviting you to come on today because my daughter, who's just turned 13, was just diagnosed with ADHD in April. So I've been like trying to learn more about it and trying to figure out what we're going to do. But, everything that you were saying, I was like nodding along because, when your son read that in Percy Jackson, my daughter actually said to me about this time last year, she said, "What's ADHD?" And I explained it to her, and she said, "I have that." And I was like, "What?" And she's like, "I have that. I think I have that." And it just rang so true to her, that description. And, I think we just thought that the impulsivity that we'd always seen in her, she'd outgrow, and she just didn't. And it was becoming harder and harder for her in school. And so I think she had a big relief, knowing that there was an explanation for it, because the older she got, the harder life was getting for her. When you're impulsive and you're 6, people make a lot of room for you, right? And when you're 12, not quite as much. So I'm curious to read your guide and see what we because of the pandemic and because she hasn't been in school, we haven't really done much yet. But it's an interesting journey for sure. And maybe you and I can talk more about my questions later, because I want to get everybody else's questions in here. So
and also feel free, after other people ask questions, feel free to ask some of your own, because
Great. So there was a question from Summer, and I'm just going to also check the other stream because I'm not sure they all show up here. But Summer says, and then I'm going to mute myself. Summer says, "Have you heard of mold toxicity related to ADHD?"
So I think that there are all kinds of theories and ideas contributing, that people bring up as a possibility. And I think really anything that affects how our kids feel physically can cause them to be less well regulated in terms of their attention and their mood. And I don't know, I haven't read a specific study saying yes, when this brings a higher risk, but I think definitely mold exposure can give respiratory symptoms and some breathing issues if people are predisposed to that. And so I think that if you notice a connection, then try to contain the environment or improve the environment so that factor is not there. Because definitely kids that have allergies, kids that have some chronic pain, chronic headaches, chronic stomach aches, this can distract them. And so it's important to address underlying distractors. And we all, if we have something that is affecting our physical health, then it affects our ability to concentrate. It just does. And so I am very open when parents come and say, I think this is contributing. And then I say, okay, then it's probably contributing. I think that it's just important to try to provide the best environment that we can as parents, but recognizing that we can't necessarily always guarantee an ideal environment. And that's also just preparing them for real life. Of course, if you know that your child is being exposed continuously to mold, then I think just for her general health and for your whole family's health, you should, see if you can find another arrangement. But some things, like, for example, if parents feel like, oh, I'm just not that organized of a person, and so I'm probably ruining my child because, they're always, our schedule's always in flux and our house is sort of messy. And, I don't buy that. I don't think that that's true, because we have the history that we have. And it always turns out, in my mind, that package of history that we carry becomes part of our genius. And for example, I grew up in a less organized environment, and I think that is one thing that allows me to tolerate the chaos of having 8 boys. So, I mean, one could say that, oh, your mom should have had the house clean every minute. And, and I have some friends who say, oh my goodness, how are you surviving? How do you not go crazy? And I just say, it's fine. I'm okay with a little chaos. So.
Also, it doesn't explain, why 7 of your boys don't have ADHD. And in my case, my 2 older sons, my 2 sons don't have ADHD, and my youngest does.
Exactly.
So it's interesting to think we've sort of, and honestly, ADHD doesn't run in either of our families. Mm-hmm. And we've sort of been, racking our brains a little bit to figure out, and I've just said, we don't know. We don't know where it came from. We don't know, it's there. But I love that, that, and also, I know that you really focus, part of your practice is focusing on anxiety. Mm-hmm. And I wanted to mention back when you were talking about other factors that could be factoring in. Right. I think anxiety, from what I've learned, anxiety can look a lot like ADHD. And so I just wanted to add that in for anyone listening too, that the symptoms, I don't know if that's the right word, of both can present the same way.
Right. I think that's a really important point. And acknowledging that some things can mimic ADHD or be coexistent with ADHD. And then you have to kind of figure out what's happening first. For example, and so they both might be present to a clinical level, and then they both might need to be addressed at a clinical level. But sometimes, for example, if a child has ADHD and is always put in this environment where they feel like they can't succeed, like they're always at one step behind, of course, that is a setup for anxiety.
Yeah.
But at the same time, some people have always been a little anxious, and they've always been a little impulsive, disorganized, and so it can all kind of come together. And so it's just helpful to really have someone to sit down and tease it all out with you, where you can really get to the root. Mm-hmm. And then say, okay, what do we think is the primary issue? And then what are the secondary issues, and what can we do about it? That's the main thing that that I talk with families about. What are we going to do? I don't even care if you want to, I even ask them, do you want the diagnosis or do you not? It's, you qualify it or you don't qualify for it, but you can take it or leave it, but what are we going to do?
Yes.
And so I think that's really important.
So there have been a bunch of other questions. I'm just going to read some to you. Melissa says, the book Taking Charge of ADHD suggests a home token system where children are rewarded for good behavior, and this is especially good for children with ADHD. And her husband is interested in doing this, but she knows that it's not in line with peaceful parenting. So Mary, I'm not sure how much you know about peaceful parenting, but we don't recommend reward systems because we want kids to learn to do the right thing for intrinsic. We look for intrinsic motivation rather than external rewards. Mm-hmm. And actually, somebody yesterday asked me this exact same question about, I think it was Russell Barkley, who has a video series, and he talks about the sticker charts and the reward systems. And so where do you see if reward systems are necessary, or if they're even helpful for kids with ADHD? Do we need to pause our peaceful parenting approach in order to help our kids with ADHD?
So I guess I am more in the camp with you of really wanting to emphasize intrinsic reasons for doing things. And so I tend to not give people prizes for just doing what's expected. And I think a good book to read to counter the other book, just to get a balanced view, because I believe that all these parenting books out there, they just they all have a nugget, but you have to combine with them with multiple nuggets to get at the real truth.
Mm-hmm.
Another book to potentially read is the book Punished by Rewards by Alfie Kohn, which is like completely on the other side of, let's reward things and create a token economy. I guess I rarely use a token economy in my family, partly because of my inability to keep track of it. So I don't like it. And also I just like to focus on intrinsic reasons. That being said, if you find that, a little game, a temporary type game or a challenge, that's a really popular thing in the entrepreneurial world right now, like, this kind of challenge, that kind of challenge. We do benefit from accountability and measuring. We do benefit from having a community that is supporting us, and we do benefit from little rewards. And I think sometimes we don't reward ourselves enough. But I don't think it has to be like, you get to buy a new toy, or you get to, eat a big hot fudge sundae, because that is kind of teaching people to value things that aren't as valuable, in the deeper sense. But, what other rewards or celebrations? I like to do celebrations in my family. Like when, I like to talk to my kids about their goals and like, what do you want to accomplish? And why is that important to you? And how can I help you? And I have a fly that's buzzing by me all of a sudden. But anyway, and so sometimes we say, let's set up something where if we do this, then we can celebrate together. Like maybe it's going out for a walk, or maybe it's having a day off from chores, or, I think maybe we don't celebrate enough, because we know that there's this pain pleasure principle in our brain, where sometimes we just are going and going and going, and we don't set in things that are rewarding, and certain things that kids have to do really don't have intrinsic benefit that they can appreciate yet. And so tacking on some additional meaning for them that's in the here and now can be useful. So I don't think it's necessarily like at odds with the peaceful parenting philosophy, but especially we can just call them celebrations, and we can have it be a structured goal system and a challenge kind of like that is set up in different by different organizations or coaches these days. So okay, I don't hear you, Sarah. I think there we go.
Yeah.
Okay.
I'm trying to mute myself with it so that the drilling doesn't take over here. And I think sometimes too, like, really working hard at helping kids see the intrinsic reason for doing something. I think that's
definitely
start there.
Yeah.
It feels better to, be able to, like, what's in it for them? How is it going to make them feel, even to be able to try something and get it or whatever. So another question, Summer says, what are the best resources for skill building?
Mm-hmm. Well, I think one of the best resources is Dr. Lara Honos-Webb's book called The 6 Super Skills. And it's basically, and she has a parenting course, and I can give you the link, Sarah, that maybe you can put in this, the notes to this presentation. There's a, so she has this training course for professionals, but she also has a parent course, like a mind building course. And it just is some evidence-based strategies for helping build focus. And, sometimes when we hear something like, 6 skills, for this, it just seems kind of gimmicky and like, someone just sat down and said, let's come up with 6 things. But this was like based on 15 years of clinical research with her hundreds and hundreds of clients, that she found these things to be the most helpful. So that's my favorite resource.
I'll have to check that out too. Okay. Then we also have, Summer also wants to know a sibling question. She said, my middle son has inattentive ADHD, and he frequently pesters his brothers. He has one older, one younger brother. It's fun, brain stimulation, making noise at mealtimes to disrupt. aggressive play, large pillows, etc. How do I address these behaviors in the moment because it's hurting our family dynamic?
Well, I think some kids, and I don't know if this is true for your child, but some kids who have ADHD, there's a high overlap of kids who have some sensory processing issues. And on one end are the kids who like are trying to avoid stimulation, like noise bothers them, lots of crowds and visual stimulation. But on the other end are people who need stimulation, like they need feedback. And if they're not getting it, they'll poke someone, they'll create it. They'll create the feedback.
Sensory seeking.
Right. So I there are a couple resources that come to mind. I can't remember the name of them, but I can get you the titles of the books. There are a couple books that are helpful on that. But I remember one of the authors talks about having a place that kids can go and get some stimulation, like a little indoor trampoline, like just a little trampoline they can go bounce on. And she also uses stretchy bands a lot, like because they just give resistance. And she also uses like bike tires that are not inflated that people can stretch and pull, and because it allows some getting out of this it's getting out energy and also getting feedback from the environment, and it can address some of that. So that's one part of the answer is, is there a sensory issue that if you provided some other avenues for him to get that feedback that he needs.
So we call that meeting the need.
Yes. And then another thing that I would say is, I think it's important as a parent to still be teaching the same standards to all your kids. So if you have one child that is has ADHD, that doesn't give him an excuse for being disrespectful to other people's space and other people's experience. And so I think evaluating how that goes, like what the sequence of events are when this happens, is there any ramification for his behavior? And I know that, in the peaceful parenting community, you don't really advocate punishments and things like that. And I'm not talking about punishments, but I'm talking about discipline as it's defined as teaching. So something where there is a boundary that is held.
We call that limit setting.
Perfect.
I'm just like doing like the translation into the peaceful parenting language of what you're saying. But yeah.
That's perfect. So I think limit setting is important to look at and make sure you are still holding your child accountable, regardless of whether ADHD is present.
So what that might look like for Summer is that if this middle brother is pestering his brothers and they've asked him to stop and he's not leaving them alone, and even though we recognize that this is possibly sensory seeking behavior, possibly just his impulsivity due to his ADHD. And what was so, just as a sidebar, was so helpful for me when the psychologist who gave us our diagnosis for our daughter was that kids with impulsive ADHD know what the right thing to do is. They just can't make themselves do it. It's like they know, they understand it rationally and logically, but it's
disconnect.
Hard to stop themselves, right? Like that impulse control. So the limit setting might look like we need to remove the brother from the situation, like in a kind and empathetic and compassionate way. If he can't stop, we need to step in and help him stop, right?
Right. Yes, I love that.
Mm-hmm. Okay, awesome. So there's a bunch of other questions and comments. Is there a connection? Okay, you answered this, I think, just before the person. Is there a connection between ADHD and anxiety? So we did talk about that. And one of my favorite resources, a favorite person for anxiety is Lynn Lyons. And she often would say, if you treat the anxiety, if you think that's, they might have ADHD, treat the anxiety, and sometimes the ADHD disappears because it was actually just this hyper scanning of the environment all the time that looks like ADHD, but it's anxiety. So hopefully that we kind of answered that one already.
And I love Lynn Lyons also. And I will mention that as an integrative pediatrician, I have an online course for kids with anxiety that teaches mind, body, and spirit strategies for addressing anxiety. And I think that's really, it's a powerful thing because, you know, we know that emotional intelligence is important in kids, you know, from Daniel Goleman's book and from the research that he did and just from common sense. But is there a built-in way for our kids to gain it? Sometimes not. And, and when we see that there is a need, then it's nice to have a resource. So anyway, I just thought I'd throw that out there too. So
okay, well, I'm looking forward to like a little list of resources that you put together for me, and then I can share them in the group.
Yes, that would be great.
Okay. What do you do with a 9-year-old? As Naomi's asking this question, who impulsively hits and punches his younger brother when he's mad. He knows he shouldn't, but he still does it without thinking.
Mm-hmm. And what, you know, I think that as much as we acknowledge that it's difficult, I think that it's really important to help a child that has impulse control issues learn to believe and conceive of the fact that they actually do have choices, even though we acknowledge it might be harder for them. But, you know, thinking about, you know, Stephen Covey's work, between stimulus and response, there is a space. There is a space there, even if it's a millisecond. And so, you know, just really helping kids recognize triggers for their anger, recognize the stress response system and understand it, and then try to do things like really fast, early on to help address that raising stress, that raising anger, and recognize that there is that space there. And so, you know, our kids do need to be taught. So, and with certain kids, they need to have extra support in learning certain lessons. And this is one of them, but it's still such an important lesson that every child needs to learn and needs to have some accountability for. So, it's hard because, you know, the struggle is maybe a bigger struggle for, you know, a child that has ADHD, but still, you know, punching and hitting, and that's not okay. And so we have to find a way to set that limit, set that boundary, and in a loving way, and partly by giving skills to so kids can have self-understanding and learn over time. So it's not going to be immediate just by telling them there's a space there, you know. You have to just, you know, control yourself. It's about practicing, and it's about, but the first step is having them to actually acknowledge the space is there and that they can choose. Because I think one risk of someone having a diagnosis of ADHD is just sort of feeling like, I can't help it, it's just me. And I think that at that point we talk to the child and say, what do you want? I want to help you understand that your behavior impacts the people around you, and here's how. And so how can we be more respectful? How can we behave in such a way that help people have a good experience when they're around you?
Well, and, you know, parenting perspective, I think that finding that, I love what you're talking about from like a brain response perspective in terms of finding that pause and that space in between the stimulus and the reaction. And from a parenting perspective, how can we help the 9-year-old care about the brother more, right? Because if there's a lot of sibling rivalry going on, then he's like, I don't even care. I'll hit him if I want to hit him or whatever. Right. I mean, I'm just kind of guessing at the situation here, but how can we look at, again, like what's driving the behavior so that he wants to find that pause? Because if a kid doesn't care about finding the pause, then they're not going to work towards that end.
Exactly. And so having a positive reason to treat his brother well. And of course, that's like a lesson of a lifetime, you know, to help our kids love each other and get along. But at the same time, sometimes we do have to help them care by attaching, with the limit setting, attaching things they care about to behaviors in a logical way. For example, if they're hitting over Legos, then maybe they lose the Legos. And it's not a punishment. It's just a saying, this is the limit, and I'm going to hold this boundary in this space because it's important. So,
yeah, I mean, we could go off on a tangent on that, but I would say that it may increase the resentment towards the brother if you then take away the Lego because he hit his brother over a fight with a Lego. So, I would
the balance.
Okay, I'm going to argue with you on that one, but we'll save that. We'll save that for another day. But limit setting sometimes does look like taking things away, and people have heard me say that in order to support the limit. But I'm not sure if I would use it in this particular instance.
Yeah, and I see your point. I see what you're saying, and you have to look at really what the result, or even imagine what the result might be as you want to choose.
Yeah. Okay, great. Let's keep moving on here. There are actually a bunch of, so somebody in that didn't show up what their name was says, Dr. Barkley argues, this is back to when we were talking about rewards, that kids with ADHD don't have the ability to understand consequences because they can't focus beyond the right now. So that the sticker charts or rewards are intended to scaffold them through the big stuff. But she thinks that you generally are agreeing with, that you're generally in agreement with the celebrations, and that maybe it's not about buying a toy or, an ice cream sundae or whatever. So that's just a comment.
Yeah.
And somebody else commented they have one child sensory seeking and one sensory avoidant. So
oh no.
And yeah, so Summer Sun, they do have indoor swings, ninja line, and that their house is becoming a jungle gym. So she appreciates the answer. So that was the, if anyone else has a question who's still on, if you do want to pop it in, we have a few more minutes. But this has been really great. Do you have anything that you would, and this is a question this is my question right now. So my daughter we did experiment a little bit with medication when she was still doing some, like, she's maybe taken it for a few school days for a few weeks when we were still doing school. And just because we were encouraged to try it and see what she thought and see what we thought. And we did notice a huge difference just on a very low dose of the medication in terms of her ability to sit and do math work or sit and read. And she previously has not been able to sit and do either of those things for very long. And do you see any, what are alternatives to medication that might help a kid be able to focus more on academics? Like, she's going into 8th grade, so it's getting to be like a little bit more serious in terms of, like, not that we're like, you have to get all A's and go to Harvard, but, be able to know basic math and have good reading skills and stuff like that. Do you have any suggestions for some scaffolding or different kinds of interventions that might help more with academic focus that is not a medication?
Well, first, I'd like to just go back a little bit to just acknowledge that, especially at certain stages, suddenly more is expected of our kids. And often these ages are like 4th grade, 6th grade, 8th and 9th grade, because they just suddenly have more and more things to accommodate in their lives and in their attention. And so it's important to kind of be proactive in watching that. And that being said, it really isn't an emergency when a 1st grader is having a little trouble focusing on some math. I mean, you have time. You have time to find something that helps. But I think when it's important to really consider medication more seriously is when the behavior is truly impacting their learning. And so there's really a gap between their ability, what their ability is, and their performance. And
there is a gap.
Yeah, it sounds like there is. Or when the behavior is very seriously affecting relationships or a person's relationship with themselves. So at some point, the struggle really does turn inward and affect somebody's feeling about how successful they can be. So at those times, I think it is important to more seriously consider medication. And I will say that, you know, when you're faced with this decision about medication, you know, we all have this idea that something, you know, quote unquote natural would be better than a prescription. And I don't know that that's always the case. And I'll tell you a couple of reasons. So, you know, I might say, you know what, if the medication works, then go for it. I have a client that I recently was working with. She has ADHD, inattentive subtype, and she's just this creative and wonderful soul, you know. But she was saying to me, like, I never get to the things that I love because I'm spending like 5 hours on my homework every day. And we did end up starting her on a medication. She said she was so happy because suddenly she could do her homework in an hour to 2 hours, and she was getting to these other things that really enriched her. And so they felt like really the outcome from that was justified the medication. When we think about supplements, it's important to acknowledge that supplements, if you're going to do a supplement, that is also taking in a substance into your body. And actually, the quote unquote natural supplements, they are not regulated by the FDA. So if you are going to go that route, it's important to go with a company that's well known and that you trust, because there is not testing happening, you know, testing that what they say is in their product is in their product, that it's not contaminated, you know, by processing and things like that. So this is a long answer to a short question, but, you know, the main things are a supplement isn't necessarily always better. And really, the medications are kind of gold standard for a reason, because they are very effective. So I guess what I would say, if you're wanting to avoid medication, is to really investigate optimizing everything else in the environment as much as you can and see where you're where that gets you. So optimize sleep, optimize diet, optimize the exercise, like having exercise built into your routine. So there's 30 to 60 minutes of vigorous exercise, like 3 to 5 times a week. And also try to create, you know, systems of organization, try to optimize the study environment, take omega-3s, and there are lots of other things that you can utilize. And in the supplement guide, it talks some more about some options, and see where that gets you. And then if you feel like, you know what, there's still a gap there, it's really not meeting the need, then I would say go ahead with the medication. And if you find the right dose and you're not having negative side effects, then the medications are quite safe. I know there are concerns for, you know, the addictive qualities of some, or there are concerns about, you know, the effect on growth, because there has been evidence that kids who are on stimulants long term have a slight decrease in expected height. But overall, people tolerate the medications really well when they're on the right dose.
Yeah, I mean, I guess like I have like somewhere in my mind, I have such a stigma around medication, because you hear like people talking about, oh, they just like give them a pill and, you know, expect like whatever. But it's been really interesting, and I actually think that me being such a patient parent really delayed this diagnosis, where I think it probably would have come a lot earlier. And we have tried so many things, and she was and by the way, she gives me permission to talk about her ADHD. She doesn't mind at all, and she actually keeps saying, you should interview me for Facebook. Like, we should.
Oh, that's nice. Yeah, and my son as well. I always am very careful about not speaking about things without permission. So.
Yeah, so she's totally like, she would love to have been in on this interview as well.
Yes.
But she had a really, 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 really bad year last year, the transition, you know, going into 7th grade. And, you know, it was the psychologist was quite worried about her and really actually strongly recommended medication because of the links. Girls with ADHD apparently in adolescence have much higher rates of depression and anxiety when their ADHD goes untreated. Anyhow.
And there are other things too. I mean, we do have to look at the risk benefit. So they have found that there is a higher incidence of like teen pregnancy and, accidents and things like that when people have untreated ADHD. So it is important to really try to find all the ways that we can support our child. And but if medication is the thing that is really going to help them succeed, I think it's often those parents that really have tried everything that are kind of hesitant to try medication, almost like it's like they somehow fit in the category of someone who's just throwing their kid on medication, but they absolutely aren't in that category because they have tried everything else.
So I guess just to be like ultra clear in my question, is there anything you know about that could improve executive function? In like, is there anything that's like, I don't even know what the question I'm asking exactly.
It's like if there's some supplement that could,
or even like some sort of brain training program or like exercises. Like I know mindfulness probably would be one of those things.
Right. Well, there are a couple things that I can talk briefly about. I mean, this I could talk for hours and hours about different possibilities, but a couple things to look into. So there is neurofeedback. There hasn't been evidence that there's long-term benefit from this, and it's very, very expensive. It's thousands and thousands of dollars to do the number of sessions that are recommended. So I usually don't recommend that necessarily to my families that are seeing me in clinic, but I don't tell them they can't or shouldn't, but there's also brain integration therapy, and that's something that is done like at the brain balance centers, for example. But again, at that kind of formal setting, it can get very expensive. One of my favorite resources is created by an educator named Diane Kraft, and I can also send you the link to this, but it's called the Brain Integration Therapy Manual, and it gives some very simple exercises for integrating the right and left sides of the brain. And many kids, especially kids who have, for example, who maybe missed the crawling stage, and so maybe haven't done the right, left motions as much. Also, this can really benefit kids who have resistance to writing, like dysgraphia, and kids who have issues with slower reading development. Sometimes this can be really helpful. It can also help kids just who have some mood regulation issues. So it's one of those things that is very low risk, but it does take a little bit of an investment of time, to do these exercises, but it can help. So also, I think yoga is wonderful. Mindfulness is wonderful. All these are like little pieces of the puzzle, but probably one of these little pieces is not going to solve things as quickly as medication in the here and now. So I would recommend, if the medication has been very helpful for your daughter, I would probably recommend going forward with it while you start integrating and incorporating these other things. And then at some point, she may want to try not being on it. And by that time, she may have put in the scaffolding piece by piece. But it can't really be done overnight,
Well, we'll see when school starts again what that looks like. I know all over the country, all over the continent, school is the big question, what we're all wondering about right now. So.
Question.
Well, thank you so much, Mary. I really, really appreciate it. And just remind people what your website is, where they can find you. And of course, I'll share the resources that you've mentioned.
Okay.
Let's see if there's one more question here.
Okay.
Oh, so Summer says, her husband was on medications for parts of school. He's no longer on meds. My belief is that he has a job that fits him and he's diligent about exercise. She's interested in your input on this, but it's her belief that meds can be useful for helping kids build skills.
I think so too. I think if kids can't sit down long enough to learn mindfulness or to do yoga or to learn these mind-building skills, then sometimes a medication can help in that process as a bridge. And I also, as you're talking about, your husband finding, basically you're talking about a matched environment that your husband has found, and that's so wonderful. And really, as we become adults, we have more freedom to find these matched environments. And so I think it's important to give our kids vision and recognize that there are certain careers that are just perfect for somebody who has.
I have this vision of my daughter as a party planner.
Right. And
an actuary. But she could be this amazing party planner, and she would be so good at that.
That is so wonderful. And in the book, The Gifts of ADHD, or The Gift of ADHD, it talks about these wonderful gifts, how kids with ADHD tend to be wonderfully creative. They tend to have social and emotional sensitivity, which can mean that they have more emotional sensitivity to work through themselves. But these things, and there are other things on the list as well, but these things are such gifts. And, a lot of companies, for example, major businesses, they want people who have high energy, who are super creative. They are the game changers of the world. So, I mean, I can imagine if we were looking at this as neurodiversity, I can see how, especially if we can just get the kids through their childhood successfully, these kids, they are superheroes. And so just like this mom that I referred to talked about her son as a beautiful electric storm, he is a superhero who's like Electric Man, So
I love how positive this has felt. Thank you. There's just a couple more comments that came in. Okay. Melissa says, thanks so much, so helpful, and that they got their diagnosis this week. And somebody else whose name isn't showing up said that was really interesting about the left and right brain integration, because her daughter didn't crawl and she doesn't like to read, write, any of it. So sounds like it's been really helpful for people other than me. So
that's good. Well, that's wonderful. And so kind of like a clearinghouse place to connect with me would be my website, drmarywilde.com. So it's drmarywilde.com. And there's a link to the guide there, or you can just go straight to the guide at drmarywilde.com/ADHD-guide. So,
all right, awesome. Well, we'll look for you on your website, and I'm definitely going to get that guide and check it out. And thank you so much. If you want to hang on 1 second, Mary, I'm just going to end this broadcast. And thanks, everybody, for being here. And reach out to Mary if you want some more support or have any other questions.
Thank you.